In this new half hour with today's health headlines, this Colon Cancer Awareness Month.
And this morning we are learning more about new research for survivors to improve their longevity and reduce rates that are now rising among younger adults.
Joining us now is Dr. Michael Cecchini, a medical oncologist and co-director of the colorectal program at the Center of Gastrointestinal Cancers at Yale Cancer Center. Doctor, good morning.
Thank you so much for having me.
Thank you for being here. We'd like to first begin by asking for your insight on new research showing the benefits of exercise for colon cancer survivors, helping them live longer. This, of course, is encouraging. What can you tell us?
Yeah, absolutely. I mean, we know exercise helps a multitude of conditions, but there have been numerous observational studies, meaning that we cannot be certain about causality, but that really suggest associations between physical activity and CRC diagnosis in the first place. But also specifically, there have been multiple studies that have shown that patients that have physical activity, there's actually a decreased risk of colon cancer-related death and better quality of life, like reduced fatigue, etc. It doesn't really have to be overly strenuous activity. We're generally hoping for 5 to 6 hours per week of at least walking. Of course, can be more strenuous. These have been part of our recommendations to patients for about 10 years.
Doctor, this research comes as we're seeing a surge in early onset colon cancer rates across the globe. What do you make of this trend, and what preventative steps should we be doing to reverse this trend?
Yeah, absolutely. Early onset colorectal cancer has been a very troubling trend, and we define that as adults less than the age of 50 that are diagnosed with colorectal cancer. And frankly, we don't fully know the reasons for this. We know that it is something environmental and lifestyle related because this incidence has been steadily rising at about 2% per year for the last 3 decades or so. But we really need to better identify which specific things are causing this and be able to then intervene. And we also need to do a better job of identifying who to screen earlier. We've already moved up the screening age over the last several years to 45 and above, but we need to continue to look at that.
Absolutely, and unfortunately, with the rising rates of colon cancer, what can you tell us when it comes to symptoms or warning signs?
Yeah, unfortunately, the symptoms for colorectal cancer can be sometimes vague, but some specific symptoms to watch out for would be unexplained abdominal pain, blood in the stool, anemia, which is low hemoglobin, low red blood cell count, essentially. Any change in bowel habits or change in the caliber of stool that is not going away, frequent gas or bloating, and certainly unexplained loss. I think one of the things that's important is there really should be no stigma around this disease, and patients with those symptoms should certainly alert their physician and again, make sure that they're getting the age-appropriate colorectal cancer screening, 45 and above for the general population right now.
All right, doctor, we appreciate it. Thanks for joining us this morning.
Thank you so much. Have a great day.